Well, now, watching that with me here and give us an assessment of the injury, we can talk to an expert, Jonathan Rees, who's a consultant rheumatologist and a tendon expert, who's very knowledgeable in these sports areas too. Jonathan, it's good to have you in. Thank you very much.
You're welcome.
What's happened? Just explain to us in layman's terms what has happened, because you've kindly brought in a model for us.
Well, we have a model here. The Achilles tendon usually runs from the calf muscle, which will be up here, down to the calcaneum or the heel here, and we've got part of the Achilles tendon here. It's a bit like a big, thick, strong rubber band, and what's happened is somewhere along its course it looks like it's we think perhaps completely ruptured. We're not quite sure. So it's like a rubber band that's been torn into two pieces.
So just to talk about the extent of the injury, because all will be revealed, I suppose, in due course, but you're saying that it could possibly be a full tear. How long would that take to recover from? How could that happen?
Well, gradually over a period of time, as we get older and with athletes who use their tendons and stress their bodies a lot, some trauma can build up, some wear and tear can build up in the tendon, which can make it a bit more fragile. So a very small injury can cause, if you like, the final straw that breaks the camel's back and cause a complete tear. If it is a complete tear that David Beckham suffered, then he's likely to be out for at least 3 months before he gets back into training, in which case that would be very difficult for him to make the World Cup. And
what's the, we'll come on to the partial tear in a second, but if it is a full tear, what's the treatment for it? What does the surgery do?
Well, the surgery would look to take the two ends of the tendon and bring it back together and tie those two ends back together, and then he would gently be able to begin his rehabilitation after that point.
Well, let's be optimistic and say it's a partial tear. What are the prospects then, do you think? I mean, what would you be looking at in terms of recovery time?
Well, I think this is speculation. I think we don't know the extent of the injury. It looked like quite a serious injury from the footage that we've seen. So I think that perhaps we're possibly over-optimistic there, okay, and really time will tell.
But if that's the case, if it is a partial tear, and as I'm saying, it is conjecture, but if it is, how long would that take to recover from?
Well, it could be a small or a large partial tear, and I suppose if it is a small partial tear, then maybe there's just a chance that he may do better than we expect, but I think we really don't know at this stage.
How common is it?
Achilles tendon ruptures are extremely common, as I say, as we age, from sort of middle age onwards. Very common to tear your Achilles tendon, often with a very small strain on the tendon, just as we saw with David Beckham last night.
And just a thought on how painful it would have been if he'd torn it totally. What's the pain associated with it?
It would be very painful, yes, absolutely.
OK, well, we'll see what happens. I will have you back, Jonathan, when we know a little more about the precise nature of Beckham's injury. But good to have you with us.
Thank you.
Thank you very much. Dr Jonathan Rees there.